Hi everyone, this is Dr. Kusuma. I want to speak about an evolution really of the treatments with UltraClear Laser. This is a customized treatment based on the individual. Before, when it first started about a year ago, we did kind of generic treatments for a lot of people, but I've had about a year and a half worth of experience with this, and I've been doing a lot of these treatments and gained a significant amount of comfort around it. So lately, I am basically customizing the treatment per patient, per area. And so if you look at the UltraClear Laser, UltraClear Laser, Ultra stands for, essentially, again, from a simplistic terms, skin tightening. And clear is clarity of the skin for pigment, etc. So Ultra basically causes, the deeper penetration of the fiber of the laser, and may and does improve the collagen remodeling, the elastin remodeling, and some skin contraction, with the laser energy that's been deposited because it penetrates deeper. However, the clear is more shallow where the pigment resides, and it also helps clear it. That's why it's called Ultra Clear. The coring is the evolution that I've been talking about lately a lot. Coring is also for a deeper, focused skin tightening. Okay, so if I were to look at these concepts, the area around the mouth a lot of times has these vertical lines, all bad texture and stuff like that. So typically, lately been doing this coring to get that skin to the vertical lines, especially improve with the deep coring. That I think is going to be beneficial, and I've been seeing good results with that. But in order to avoid any pigment issues, I also do the second pass with the clear setting as well. So gets two passes at a particular depth because the skin is more coarse and more textured. So this is a deep treatment with the laser coring and a clear treatment on the surface to avoid any pigment. I also can be coring, but shallow treatment, because the skin here is very different than the skin here. As all of us know, the skin around the eye is very delicate, very thin, and doesn't have a lot of fat underneath it. So the treatment here is very different than the treatment here. And so the treatment here is a little shallow coring plus the clear treatment on top of that. So it also gets two passes around the eyes, similar to here. The difference is the setting of the coring is shallower than it is around the mouth, and the setting of the clear also could be a little shallower than around the mouth, for example. So these are customized areas of treatment. Sometimes the nose requires a different treatment because people have a lot of deep pores there. So for that to improve, I may just do the combination treatment called Ultra Clear together in one pass instead of separating them. I do a deep treatment of that with Ultra Clear for the cheeks, for the forehead, and maybe for the nose. So you can see that in just one phase, I could do various types of treatments based on the problem that the patient has. And when you do it customized in this fashion, you're now maximizing the outcome based on the problem and not just doing the same thing for everybody. Because you do have to consider the age of the person, the skin tone of the person, the ethnicity of the person, and the general texture and any issues with any type of acne and things like that. So this is where we're headed, and so it's called custom treatment with UltraClear Laser. A very important consideration, obviously, patients would have is how long does it take to heal, how painful would it be, what would I look like, etc. So the coring treatment, whether it's deep or shallow, within about 5 to 7 days, the skin heals over very nicely. And the clear component of the second pass also creates some of that light injury on the surface. So combined, for coring plus the clear treatment for these specific areas right now, I noticed improvement within about 5 to 7 days where there'll still be some redness, but the rawness is gone. So you may have some peeling, some marks, some minor issues, but within about 5 to 7 days it's generally healed. If I do the UltraClear treatment together in one pass of the cheeks and the forehead, etc., that could take sometimes 8, 9, 10 days, 12 days to heal. So the healing time varies based on what type of treatment is done for the face. So as an aggregate, when I do this customized treatment plan, we generally tell patients that count on about 10 to 12 days of downtime where you would have all of the peeling and the healing done, where the skin is already able to have makeup put on so that you can go out. You have to avoid sun, obviously. We have to do the skin treatments with the skin protocol that we give you with this treatment. We'll do all of that, but healing time is that. The first 2, 3, 4 days are somewhat uncomfortable for patients where you feel a little hot, maybe feel a little crackly or tight, may need a lot of moisture because the skin feels dry. So we go over all of these things, but as far as the absolute time limit, the coring heals a little bit faster. UltraClear treatment, which is a deeper treatment, heals a little bit less faster or takes a little longer. But all in all, within about 10 to 12 days, most of it will be fully healed so that you can apply a little bit of foundation or makeup and go out and do things. So you have to factor that into these treatments.